Welcome. Today we are diving into the topic of addiction and recovery to bust some common myths. Outdated and incorrect information about addiction can lead to shame and embarrassment, making it more difficult for those who need to seek treatment. It's crucial to talk openly and honestly about addiction so that those who need treatment get the support that they need and those around them understand how to be a positive support system. Let's explore some of the myths. Myth number one: drug addiction is a choice. They could just stop if they really wanted to. Reality: this is one of the biggest misconceptions. Leading authorities on addiction agree that substance abuse is a chronic disease, similar to heart disease, diabetes, and cancer. Life circumstances, trauma, mental illness, and genetics are some of the factors that can lead to addiction, but sometimes none of these are involved. Addiction can happen to anyone. And once it takes hold, brain chemistry changes, making it hard to control impulses. The substance becomes an obsession, overriding all other rewards. Myth number two: individuals who struggle with addiction are bad people. Reality: no one plans to become addicted. It's a force that takes hold regardless of life circumstances. Individuals struggling with addiction may steal money so they can buy more drugs, become less available to their family and friends, and make irresponsible choices. However, they didn't become addicted because they were bad people. Addiction can change behavior, but it does not define character. Myth number three: if I try to support someone with an addiction, I am enabling their bad behavior. Reality: the fear of becoming an enabler often does way more harm than good. Instead of thinking in terms of enabling or codependency, consider what is healthy or unhealthy. Loving and caring for someone struggling with addiction is not wrong. Supportive relationships are crucial for recovery. Myth number four: relapse is a sign of failure. Reality: relapse is a natural part of the recovery process and does not equate to failure. According to the Journal of the American Medical Association, 40 to 60% of individuals who receive substance use treatment will relapse within 1 year. Many people, like my daughter, will have multiple relapses, but go on to achieve long-term recovery. Myth number five: once you receive treatment, your battle with addiction is over. Reality: addiction is a lifelong process that requires ongoing effort and unconditional support. Initially, I believed treatment would end my daughter's struggle with addiction. However, I learned that maintaining recovery is a continuous journey that demands constant effort and support. These are just a few myths about addiction that contribute to the stigma surrounding it. These misconceptions can pose additional challenges for those seeking treatment and their families that are trying to support them. Understanding the reality of addiction helps create a more compassionate and effective support system for those in recovery.